we do our cats on Thursday, we want to get a couple cats that we dissect that have better. This one has many failures, and one of them is the injection worked really well for the blue, but not well for the arteries. Okay, so you're not going to see a lot of red. So if we can do a red one, that would be great. If we could dissect one that has red. Okay, so you just can open up the sternum, but you don't need to take any of the organs out. From the heart, we're going to go up, and they have a huge mediastinum. Superior vena cava, much bigger than ours. That's the superior vena cava. When it branches, it's left and right brachiocephalic. When the brachiocephalic branches up, this is the external jugular. Okay. If we're going out, it's subclavian. Now, subclavian on the cats is so tiny, you won't hardly see it, but on humans, you will. It'll be under your clavicle. It pretty much goes axillary right next. It's pretty much axillary. All of this is axillary. Axillary will become brachial. Brachial will become radial and ulnar. Okay. The only other, two more. There's one here, over here. This is the cephalic vein. Okay, and it's going to wrap around the head. So kind of remember it as like, oh, this one's going to go around the head. Behind the heart, if we were to take the heart out, which one of you might want to do, take the entire heart out. Back here on the ribs are the azygous. They're way back here, and they run between the ribs, and it's artery and vein. So red, artery, vein, blue. They're the only ones back there. And I think one of us probably should just take everything out. Okay? Okay. Below the diaphragm, one of the group is going to need to take the liver out so that we can see the celiac trunk. Can't see it on this cat, but the celiac trunk will be the first blood trunk coming off of the aorta. Okay, so this is aorta, even though it didn't get latex, it would be really red. Okay. This is vena cava. So the celiac trunk would give rise to the hepatic going to the liver, gastric going to the stomach, and splenic going to the spleen. And we don't have that in this one, so one of us is going to have to pull it off, and we'll see that. Okay. If we follow the vena cava down, you can see the kidneys, and look, she has really nice kidneys, and look at that blood supply. So that is the renal vein. You can actually see the artery too, coming off there, right? That'll be a nice, easy one to see. These are, look at her lymph nodes. She was a really healthy cat. So we go down here. She actually just gave birth. She has very large ovaries. They look weird, but these are actually ovary. This is sort of ovary down here. This is the ovarian vein. You're probably not going to see it this beautiful on any other cat. So there it is, and the arteries there too. The next one coming down, this is the lumbar vein, and it would wrap. It's going to go back to the lumbar region. Now where we split, you can see the aorta sitting on top. The aorta and vena cava split like this, and that's the common iliac, left and right common iliac. They will branch, but as they leave the pelvis, it's femoral, over the femur, tibial, over the tibia, and fibular, over the fibula. I didn't dissect it out, but just imagine it's there, okay? So the blood vessels we need to find in some cat somewhere are, we need to take the liver out, we need to find the celiac trunk, and we also need an injected mesenteric. So this would be the inferior mesenteric. Okay. And you can see it's sort of in there, but if it was injected nicely, it would be the inferior mesenteric end.
It's an artery?
It's both. Artery and vein.
Okay.
You can sort of see that, you can see them running in there, and they feed the small intestines.
Okay.
So that's our job for Thursday, is just to find a few of those things and then call it good.
Okay.